Share my screen. The self-care. Okay. So can you guys see the canvas?
Yes.
Okay. So clinical intake assessment with prompts. Let's look at this real quick. I do want to go through. Okay, make sure here. So we'll kind of go through this. So this is something that the counselors use in at Abundant Life, the biopsychosocial assessment. Um, so which is an intake. So this is done when, okay, so the person calls in, they get scheduled with a counselor, they come in, they fill out all of their paperwork. And so what the counselor sees beforehand is their chief complaint, pretty much, or I say their chief complaint, it's what they may tell the person that they're calling in over the phone. So that doesn't mean it's their chief complaint, because a lot of times what happens is they call about something, but it may generally not be the thing that they're calling in about, um, because maybe they're too afraid to talk about it or ashamed or something. And then they come in and it may be totally different um, on something that they talk about. So, initiating the intake and setting the frame, okay? Um, so what's the chief complaint look like? So they're calling in, they're saying, "Hey, I'm anxious about something." So that may be the overall thing. So, okay, you're thinking, okay, somebody's coming in and they're anxious about something. And they may even go as far as on the intake, the phone intake of telling you the backstory. And the person, who's doing the call may type in, okay, here is what they, are coming in for. Okay, so let's take this. Initiating the intake and setting the frame. So this is the assessment that you're going to do, or you may have your own type, but you're doing an assessment when they come in. So opening, greeting, and statement of expectations for remaining time of the initial session. So sets clear expectations and agenda for the intake. So this is how I've done the counseling when they're coming in. Before I get to this part, I may read, what's bringing them in, but I also want to make sure that all paperwork is done and they have signed the informed consent and they understand. So I will take them through the informed consent. Guess what you're doing during that time? You're assessing, right? You're assessing during the informed consent. I am explaining things. Are they asking questions? How involved are they? So you're assessing, how maybe even their emotional regulation during this time. Are they able to sit there during this time, or are they, just so anxious that they can't function in a great way? Are they asking questions? What do they look like? So you're assessing them from the minute that you even just see them. Okay, when they sit down. Okay, so today you and I will be doing what we call an intake session. I'll have many questions for you, some of which will focus upon the current difficulties you may be having, and some will focus more upon your background and history. So I want to take you through this. This is kind of like scripts that you're going to be using, that you can use with them. But uh, so we'll kind of be going through, what's that look like? So mostly I want to try to understand what you're experiencing so I can try to figure out what kind of help would be best for you. So what you're telling them, I'm going to be assessing this whole meeting that we're going through. Near the end of the session, I'll try to provide you with my impressions and recommendations as to how we should proceed next. These will include whether or not you're seen for follow-up sessions or whether it might be more appropriate to refer you to elsewhere for help. Before we become clear about these options, I basically need to obtain and explore a lot of information with you. So at this point, do you have any specific concerns or questions? So I'll sit down, go through the informed consent, and then I'm going to go, this meeting here is to assess how we are going to move forward. And then I'm going to ask them, what brings you in? What's your chief complaint? So the chief complaint says this section sets the stage for the rest of the write-up. Okay. It is usually no more than one or two paragraphs long, as you're creating your new paperwork. Its central purpose is to express concisely and clearly the questions and concerns of the person seeking treatment. So you're going to be asking them questions and you're writing down. During this time, a lot of people will go, is it proper to have a folder there? Is it proper to have paper that you're going to be filling out? Is it proper to be writing during this time? And here's me. I took notes all the time. I mean, that was just me, but I didn't make it a distraction. That was the whole thing. You can sit there, you can take notes. And I think, even when you're doing it in a way, you can still kind of look at them as you're writing, and things like that. But I just didn't write a lot of things, but I did take notes. And the other part is I wrote down some questions that I wanted to ask them along the way, because if they're explaining a lot of things, and it may be just one word that will remind me of that question. But as I got older, I found I forgot a lot of things that I wanted to ask them. So I would write down questions or maybe keywords as to what I wanted to ask them. So yes, I took notes during that time. So brief psychosocial history of the client. The depth of history explored within the clinical intake has everything to do with the information a clinician needs to understand about the patient's presenting problem within a psychosocial context. If the presenting issue is clearly situational based with good premorbid functioning, then the social background could be relatively brief. Does that make sense? So if they're coming in and they're coming in about something specific, it could be maybe they're grieving somebody, or they've just had a breakup, or something that has to do with that part of history, the present. And you don't need to explore a lot back. Then your questions about the past are going to be minimal. So we're only going to worry about what's going on right now in that situation. Or conversely, with complex psychopathology and a previous history of difficulties, the information gathered will necessarily be more detailed. So guess what you're assessing during this time? You're assessing, what do I need to do? So based upon what they're coming in for, I have to perform a lot of questions about history, or I don't have to, okay? So first thing we want to do, and they've told us what their chief complaint is. Then we want to go back to what are the symptoms reported, okay? So critical data needing definition or elaboration. So what is the presenting problem? Okay, so they tell you X. And then, okay, what is the background of that problem? How did we get there from here? So we want to find out all of this. And so I'm going through this right now because this is the initial intake assessment to underscore what assessments we need to put in place. Okay. So there is a process to all this. Okay. So what's the presenting problem? What are the specific symptoms? So we're going to write down those things. Symptom duration. How long have we had it? When did it start? And how is it getting worse? How is it progressing? Whatever that situation is. And then, maybe I take into consideration like something in my own life, anxiety. I've been transparent about I've had anxiousness, in my life and all that stuff too. And I was an anxious kid, right? So growing up, so I had anxiety. But I'd say 12 to 14 years ago, it got a lot better to where it became even physical, um, meaning lightheadedness, dizziness, things like that would come on. And I didn't know how to take care of that, so this is kind of thing. So I would tell a counselor if I'm doing that, here are my symptoms, how long is it, and this is the progression over time that I've had with anxiety. Symptom acuity. So at one point, I can't remember how many years ago, I had a panic attack. I haven't had one since, but it seems like I've been on the verge of panic attacks, every once in a while. But I did have one, so I experienced it. The good thing about it is when other people would come in with anxiety, I sure understood it. And if they talk about panic attacks, I sure understood it, right? So it was a good thing. Symptom acuity. And what's the extent of the functional impairment? Okay. So then, current, recent, uh, what's happened currently with what you're experiencing, even post, or history wise, even not so long ago history, what's been going on up until now. Um, and then history of previous episodes or other psychiatric difficulties. When have if somebody has experienced panic attacks, when else have you had them? What was going on at those times? What has been, we want to go, what kind of environment were they in? What was um, what were the relationships that they, were having during that time? Was it work related? What's related with all of these things? And then current relevant psychosocial issues. What about their relationships? Love relationships, friendships, family conflicts. Does that go into it? Employment, school issues, academic functioning. What's going on? I even go into spiritual, what's going on with you spiritually now. How about your past? Even go and give me your testimony, go through your testimony, um, so that I can see, how that has affected their life, who in their life has helped them with things, what's church life like, things like that. Okay. And then, I do bring in emotional, what's going on emotionally, physically, and then also nutritionally. I talk to people a lot about nutrition and things like that too, to go along with all of those things. So then B, much of what is asked during presenting problem and background information gathering will reflect the various decision trusts, I don't know what the decision trust associated with the DSM diagnosis. So what you're doing is, if as you're starting to assess and narrow things down, you're like going, okay, here's a person that has anxiety. Then I want to go in to the DSM, go through the DSM, all of the stuff in it to see, do they meet the criteria for what, right? What specifically do they meet the criteria for? Is it generalized anxiety, meaning that they've had this for a long time and it's kind of chronic? Or is it specific to an occasion? Things like that too. So how can I diagnose them if I am going to diagnose them with something? Okay. Okay, so then we've done everything individually. Now we're going to go to what's the family history? What is contributing to what is going on in their life? So this section should include important familial background information. For example, what's the opening question? What can you tell me about your current relationship with your family members? And follow some exploration of the answers to this question is a good follow-up general question might be, what seems important and relevant regarding your childhood and early adolescent development? What are we looking for there? So now we're going back in time. Where did this start? What are we looking for here? So I'm asking these questions.
Well, it depends on the presenting problem to a degree. I might look for slightly different pieces depending on if they're coming in for anxiety or depression or trauma or whatever.
Yeah.
Because if it's like, what can you tell me about your current relationships with your family members? I may be looking for maybe a history of, depression or maybe a traumatic event that would lead to depressive issues or childhood, issues, things like that. So, whereas it may be different depending on if they have anxiety. I may be looking for, what were they given certain pressure? Were they put under certain pressures? Did their parents have certain expectations? What was their attachment style? So things like that.
Good. Yeah, excellent. So let's keep on, let's just to be consistent, like what you were asking, let's be consistent with anxiety. So if as we're moving forward, so those were perfect. Thanks. What other things might we be looking for as it pertains to maybe anxiousness? Just how like I explained my own anxiety. What would we be looking for? Any other thoughts? One thing that I would want to look for is what was the environment growing up? So if I'm asking, what can you tell me about your current relationships and your family members? How am I still with my family? Things like that too. So the next one is what seems important and relevant regarding your childhood and early adolescent. So what I want to also look for during that time, I may do a genogram, things like that too, but I want to know what the environment was like. Was there anxiety in the history of people? So, or what type of environment was there or atmosphere that may have caused anxiety in my childhood? So, just thinking about my own, it's like um, it seemed like high expectations and to be perfect and things like that. So there was a lot of anxiety with that. I had to perform, I had to, be perfect or whatever. So, so those were things that would go along with my childhood or adolescence that would increase the development of anxiety within my life, right? And so, how else was there anybody else in your family that had anxiety? How did they cope with it? How did what were you taught any coping skills? What was your attachment style like? What was the attachment style of your family like? Was there secure attachment? If it was anxious attachment, meaning, um, you had to be perfect or whatever, um, with that attachment style, that seems like that would be in your relationship. So how did you handle the other relationships? So much, can go on along with those kind of questioning. So B, if patient proceeds easily, passive listening may be adequate. What's that mean? What's passive listening may be adequate? What's that mean?
Well, they're talking, they're giving you information. You don't need to interject anything except maybe a nod or, uh-huh, or something to let them know you are listening.
Very good. Yes, absolutely. So you can proceed and just by listening to their story and things like that, and they're like going, I know exactly what was going on with me and all that. And I don't have to ask too many questions in it. And maybe they've been in counseling before and they know what the procedure is and process and so on. Okay. So, however, as the role of the family relationships in history is often complex and unexamined, further prompting or clarifications may be needed with questions such as this. How would you describe your current relationship with your parents? Okay. What's your relationship like now with your parents? Does the client come from an intact family? Are they divorced family, blended family, so on? single parent, adopted? What did it look like? How would you describe their family atmosphere growing up? What was the environment like? Was there a lot of anxiety? How did your family handle stress? What were coping skills and so on? Okay. Um, who took care of the client when growing up? Was it the parents? Did they have a caretaker that came in? Were they with grandparents more than parents? Um, were the parents not in place and it was strictly with the grandparents? What did all of that look like? Who took care of you growing up? Who made the rules and enforced discipline at home? Really, that's important. Who made the rules? Who enforced them? Were there rules? That's another thing. Or were you left to your own, devices, right? How did your parents solve their disagreements? What did it look like in front of you, your parents? Did they argue? Did they Were they loving towards each other? Were they non-existent towards each other? What did that atmosphere look like? Because that's going to make a difference in the way that you regulated and things like that. Do you have brothers and sisters? What are their ages? How is your relationship with them? Same thing. What was the environment growing up? Um, when were you first aware of your sexuality? How did it manifest itself in your life? Can you describe your parents' attitudes towards sexuality, um, including familial norms and comfort with the issues of sexuality? Were you able to talk about things? With your parents? Were you able to ask questions? Things like that too. Please report the current relationship status of the client. Are they single, married? Um, were they previously divorced? What's their relationship status now? What's that like? Then I want to even go to how did your past influence your present relationships? Okay, even kind of talk about those things. That's going to lead to a lot of different assessments that you can take. Okay. Let's see here. Were current family and psychosocial information, um, is it clear and without identifiable uh, pathogenic elements, or were there difficulties and painful experiences during childhood? So was there trauma growing up? Um, any unrealized trauma that may be affecting you in the moment, right? And some people, as trauma is, people disassociate and stuff like that too. Do we need to look for um, those types of things? Um, your childhood, adolescence, and so on. Overall, most of the clinicians' questions are focused upon ruling out, okay? Ruling out things and then elaborating on aspects of their life. Okay, so we want to rule out things so we can get to what? An assessment that's going to help us start to pinpoint. Okay, it's kind of like going to a doctor. And your doctor says, "Okay, tell me what's going on." Well, I get lightheaded. I have trouble with something, right? And so then we're going to start ruling things out as a doctor. And maybe it gets down to I take your blood work to see what's going on there. I take your blood pressure, or do you have high blood pressure? What's that like? What medication are you on? And so and so. What could be causing lightheadedness? Okay. So what about medical history is the next one. So that's what we're going to do is what is your medical history? Is there anxiety that's in your family? Is there um, so is there a list of medical problems that your family has had? So briefly discuss, and only in terms of how the physical problems impact mental health, if known. So briefly discuss with them how anxiety has affected their life. Okay. Here's another thing, very important, right? Alcohol and drug history. So report current, past alcohol, illegal drugs, or prescription drug use, abuse. This should include frequency and quantity. So specific substances used in your current right now, or what have you used in the past? What was the quantity of it, frequency, duration? It's really helpful to be quite specific. So talk to me about why this is important, the drug use. And so even if it was in the past, why is this important?
Can I make a comment about the medical history?
Sure.
Um, I think, like, just coming from my personal experience of being a two-time cancer survivor,
Yeah.
um, it was important for my counselor to ask me about that
Yeah.
because I actually had some significant trauma and triggers from that experience, that I didn't even realize was trauma. It was just you do what you have to do, and and so I didn't. But if she hadn't have delved into that and made me look at it, I would have continued to think, well, it was medical treatment, it wasn't trauma.
Mm, that's so good. So how did you handle that, I guess, in counseling and things like that?
She just had me talk through it and help me understand that, trauma doesn't have to look like it does on a battlefield. It doesn't have, there's a lot of things it doesn't have to be to still be trauma, and that can be relative and it can be somewhat personalized, because what is traumatic for me may not be traumatic for someone else.
That's really good. Yeah, absolutely.
Um, And then as far as the triggers, to be honest, I had neglected my physical health because of the triggers to go to the doctor.
Mm,
Um, and so she's suggested EMDR for some of that stuff.
very good.
So,
Yeah, so yeah, I mean that's a great example of having medical. So that was significant. Cindy, how long did this last?
well, to be honest, it's something I've recently worked through. Um, and I am, in February, I'll be 20 years out from my first occurrence, and I'm 11 years out from my second. So it went on a long time without me really identifying that this was a traumatic experience. And just because my cancer was caught early, didn't mean that it was any less significant or any less traumatic.
Mm. So yeah, you've dealt with it a good period of your life.
Yeah, I was diagnosed at 37.
Yes. Okay. Yeah. So as a counselor, I would take that into effect and maybe ask questions around that too. It's like, what was the treatment like for you? How did you handle that? How did you handle stress? How did your family handle stress? How did they handle you? Things like that too. Yeah, there's a lot that can go into that. Thanks for bringing that up too, to help us think about somebody who's been through those types of things, right? Or even currently in that position. Yeah. So alcohol and drug use, we talked about that a little bit. So important to examine the patient's perception or judgments regarding the problematic nature of the above. Is there a perceived need for help? How do you get help? How do you cope with it? Um, yeah. Next, history of family drug and alcohol involvement and treatment. Is it genetically there? Are you predisposed to situations of drug and alcohol? Is that in the environment, that you're in, and so on? Okay. Legal history. So report previous arrests, convictions, incarcerations, nature of the offenses, date, location, and incarcerations. So see, we're including everything in, these people's lives, even their legal history. Um, were they incarcerated? Is it, for how long? Things like that too. So we're finding all about their legal history because during that time, how did that change your life and perception of life and things like that too? Military history. Is there,
Uh, I
yeah,
asked, I wouldn't have ever thought to ask anybody about their legal history.
yeah.
Unless it was something they said initially, I wouldn't have ever, just off the top of my head, thought to even delve into that area.
So thanks for bringing that up, Felicia. So, yeah, that's the thing by following these scripts, that you have, to do the preliminary assessment. Um, what can you ask? So think about now that you've seen this, what could you ask around people's legal history? So you're sitting with somebody, maybe, if they have anxiety or whatever, but then there's a history of something. What would you ask? What are
Uh,
some things?
if I was, I mean, if I, like I said, if I would thought to ask it, like I wouldn't, if I wasn't following this script, I wouldn't have ever thought to ask that. But if I know, okay, this is something I need to ask, I could see it being relevant, especially if they were incarcerated and maybe they had a bad experience with the police that caused anxiety, or while they were incarcerated, something happened that could have caused anxiety. So yeah, I could see that now, but like I said, I wouldn't have ever thought to do it off the top of my head. So
Okay, good. So would you ask them what were you in for?
yeah,
Yeah, and
and
what
how
would
was that experience, and what did you learn from it? Was there anything that triggered? There's a lot of questions you go into it, but
yeah,
yeah, I just
especially
want to.
yeah, and especially if you ask what took you there, right? So maybe it's a history of writing bad checks or something, right? Or tax evasion or whatever it is. So you're looking at maybe you're looking at, what in their life is different. Is there a character issue? Things like that too.
I would think it'd be also important, not just what is their legal history, but what is their involvement with the police and court system, because they could have been, a victim and, had to go through testifying or something within the court system that, I mean, that might even open the door to finding out they are a victim. Um,
Absolutely.
but they could have anxiety surrounding it, even if they weren't the person who did wrong.
Yes, excellent. That's very good. Yeah. Or if they've been part, maybe a divorce case or something like that. What was that like for you? Did it get nasty? Did it get, you know, or was it smooth sailing? Whatever. Um, yeah. Military history. So is there a history of military involvement or any exposure to combat? That's pretty good. Yeah. What was your exposure in the military? Then psychotherapy history. Is the client currently receiving outpatient mental health treatment? If so, where and to what extent? What's the type of treatment, how often, and so on? If not currently, have they in the past? If so, when was the last time they were in outpatient mental health treatment? Have they been hospitalized for psychiatric reasons in the past? If so, when and for what? So very important. Okay, so then we want to go to, so we've learned all about their history, and now we're going to learn about what's their present, what's going on in their present. So we have assessed their history. Here's what brought them there to this point. Okay, so what's happening today? So this is the assessment that we're going to do when they come in, and it's a lot of it's subjective about what you feel, and then for questions that you can ask. So, activities of daily living. So, the client stated that he is able to cook simple meals and do household chores. He has no problems going shopping. Claimant is able to also perform personal hygiene independently. When asked how the claimant gets along with others, the claimant stated, when asked to describe a typical day, he states, his hobbies include whatever they are. This is what I do on a daily basis. Is the client involved in community activities? Do they belong to a church? Other organizations? Do they volunteer for things? So we want to know what's their daily life like? Do they just sit around playing Xbox all day? Or do they work 3 jobs? What is, going on in their life? So other pertinent information, what about suicide? Do you have thoughts? These are the questions we want to ask them about this, right? Do you have thoughts of wanting to harm yourself? If so, do you have any current intent or plan? So that's your first question. If they ever have idealization is, do you have a current thought or plan, means to do it, or any other thoughts of harming someone else, and so on. Okay. If yes, please address safety plan with the client. So this came out in our assessment, and this happens often, especially more along the lines of adolescents who, let me give you kind of an example. I belong to this group, and it's called Choose to Live. And we just partnered with another counseling, I don't know, it's kind of a big outfit. And we go into schools and we do assessments with kiddos there. And they went into one school. Out of 40 kids, 10 of them had thoughts, right? Out of those 10, 5 had gone through some, I don't know, was it, you know, thought heavily about it or plans. 2 had attempts. So out of 40, 2 had attempts, right? Um, and needed to be taken. So out of those 40 people, I think 5 of them got into counseling, and 2 of them need to be taken in to have further exams, right? So this is just out of 40. Can you imagine the amount of kids that are in school that need that help, that don't get that help, aren't properly assessed, and so on? Okay. What about homicide? Do you have thoughts of wanting to hurt others? So we're mandated reporters, right? Suicide or homicidal. We're mandated reporters. What specific thoughts do you have about that? Do you have specific intent or plans to follow through with any of your thoughts? If yes, please address your safety plan. So then we're going to create a safety plan again over that. Okay. And then do we need to consider notifying authorities? How bad is it, right? We've assessed the danger, okay, the risk. Trauma history. Have you been a victim of a traumatic event? If so, provide me details with that and how they may impact your current living situation or your functioning. Okay, so then we're still assessing them, right? So what's the display of mental status, right? So we want to go to their grooming. Do they look normal? Is it meticulous, or do they look neglected? Is there something about their grooming, like they just came in, it's 30 degrees outside, and they're wearing shorts and a tank top? Okay, what can we assess about that, right? I used to go to church with this guy. It didn't matter year round. He was in shorts. He was in his 20s. So I'm like, okay, that's good for you, but no, I'm not doing that. But I don't know that I would assess him as having anything too mentally wrong or anything. But anyway, he just wore shorts. That's all he wore. And then funny thing is he got a job. This is when he was like only like 19, 20 or whatever. Then he gets a job. And guess what? I saw him at church in what? Pants one time. Everybody fell over. But it was almost like he grew up. Okay, so orientation. Do they understand who, the person, place, time, Are their orientation of their life, are they fully oriented with what's going on? What's their affect? Is it appropriate? Um, Labial, is that labile? Restricted, blunted, flat. What is their affect? How are they presenting themselves? Are they good? What's their mood? Um, are they anxious, depressed? Are they okay? Pessimistic, irritable is another one that you would see. What's their mood like when they come in? Then you want to do this every time they come in. Does it remain the same? Are they irritable every time they come in? Okay, so now we're going to say if they've come in 4 times and they've been irritable 4 times, we got to start investigating the irritation, things like that too. Okay, speech flow. Is it normal? Are they loud? Um, I like this thing, flight of ideas. Do they finish their ideas or do they just go on to the next thing? So if they don't, maybe we're assessing for ADHD or something else that may be even more pronounced that we need to look at. Thought content, is it congruent, incongruent, and so on. Intelligence, are they above average, below average? Do we need to investigate that? There's a thing there too, says needs investigation. Do we need to maybe do an assessment on intelligence and so on? How about judgment? Are they in good judgment, fair judgment, poor judgment? Do they tell you stories of, I went gambling the other night. I've gambled for the last 3 nights and I've lost over $10,000. And I own them like, okay, how frequent is that? Well, I do that 3 times a month. So sometimes I win, sometimes I lose. Okay, so maybe that's something that needs to be investigated. Okay. Is it judgment or are they just bored and they have a lot of money? Who knows? What are we looking for? Insight, is it good, fair, poor? Are they able to, talk to you about things in a way that makes sense and they can make sense of things and so on? So then we've gone through all of those things within the first meeting with them. Okay, hopefully first, second, third, whatever. By the time we get all that done, what's my provisional DSM-5 diagnosis? Here's what I'm going to say about this too. It really depends on where you're at, who you're seeing, things like that too. Because there might be just a place like just I don't want to say just church setting or whatever, but people just coming in with just normal, everyday, run-of-the-mill issues, and they don't need a diagnosis, right? So somebody just ran over something out here. Sorry, looking at something, and I could see it coming. So um, anyway, so something may not be diagnosable or anything like that too. So what are the reported symptoms? What's the clinical presentation? This is stuff we're going to start putting in our report, right? What's their psychosocial history and test results to substantiate your diagnosis? List the diagnosis from other significance, from the highest diagnosis to the least diagnosis, if there's more. And this will be more in a place where you're going to have probably multiple ways of doing that. Also, for example, you would list major depressive disorder before an adjustment disorder because that needs the most attention, right? Or do I need to start working on adjustment disorders? So then you're creating your treatment plan. Which one do I work on first, and so on. Then that's where this comes in, your case, all of this stuff that you've collected. Now I'm going to start formulating my treatment plan and my case. Okay, so I'm writing up my case. This is a paragraph describing the deficits and strengths in psychosocial capacities, as well as identifying any of these. It says disruption models, but anything else that needs to be considered in your treatment plan. So, how do I help this client address the presenting problems? Consider the expansion of self-functioning, improvements in object relationships, contextual barriers, and so on. What is my treatment plan? How long is this going to last? And here's where this class comes in. What assessments do I need to include in this treatment plan to help with whatever my diagnosis is? So then you go back to your family history. Do I need to do attachment? And do I need to do a Myers-Briggs personality? Do I need to do, or if they go into depression, do I need to do a Beck depression thing that's long, or can I just do it with one that's shorter and it's 10 questions rather than however many? So going through all of this stuff will help you conceptualize what needs to be done. What are your thoughts?
Did you say that this is what we would like? Is this basically what our notes are going to look like at Abundant Life? Like for,
Go ahead.
or what,
So this is what like your initial, your initial,
for internship, I guess.
yeah. So your initial intake with them, you're going to go through all of these things, and then you're going to write out a note and a treatment plan. So this could be part of it, like the display of mental status can be all part of it. You know, it's got these radio buttons, and you can go through. Maybe after a while, I'll bring up what, kind of creating a note would look like in our software that we use. Because previously we would do all by hand, and we would keep the notes in a folder. I love software now. It just makes it so much easier. Yeah. Any other thoughts? I know this may all seem boring and stuff right now too, but this is going to be something that, if I can have every time somebody comes in and I have a checklist of things to go down and help to go through all of these things, it's going to help you tremendously, not only your confidence, but how do I create a process of helping helping clients that come through. Okay. So, do you guys want to go through the things that you found and kind of talk about it a little bit so we can talk about a few assessments?
Sure.
You sure? So no, let's make this fun. This is something, it's not like, going out and all this stuff. Let's make it so it's like, here's what I saw, here's what I discovered, things like that too. Does anybody have one right off? Here, let me stop sharing. Does anyone have
I have one.
Who was that?
That's
Susan?
me, Susan.
Oh, okay, cool. Do
Um,
you need me to share with you? Or do
uh,
you want to talk about
I didn't make a PowerPoint or anything
No, you don't
before.
need to do that. Yeah, that's okay.
Yeah, I just wrote down the question and answered the questions that you had on the email.
Okay. I just didn't know if you needed to show anything.
Oh, okay, no.
Okay, cool.
Okay, so what is the assessment was the first question, and my assessment is the Minnesota Multifaceted Personality Inventory Test, the MMPI.
Yeah.
The second question is who or what is the assessment created for and what does it assess? And I found out it's designed for individuals 18 years and older. It's created to assess psychiatric conditions and is a widely used psychological assessment. It assesses mental health, illness, and personality, both in clinical and non-clinical settings. The next question was, what information does the assessment provide? It was developed in the 1930s to help mental health professionals evaluate people with psychiatric disorders. It is used by clinical psychology professionals to assess and diagnose mental health, but also in other areas such as legal cases, custody disputes, professional employment, like high-risk jobs, and in substance use programs. The next question was who created the assessment and why? It was developed in 1937 by Starkey Hathaway and a clinical psychologist and neuropsychiatrist, J. Chamley McKinley at the University of Minnesota. And they did this because they thought existing self-report inventories were too transparent, allowing respondents to guess their intent and manipulate the results.
Oh, that's good.
Yeah, I thought that was interesting.
So what I'm hearing is they have questions in it it's kind of like, you ask these questions and some of them so some of them really sound really close to one another, but they can mean different things. Does that make sense?
Yes.
So yeah, so it's kind of like very well put together that so they can't just guess what they should answer. Does that make sense?
Yes, right. Then the next question was, what does it measure? And it measures 10 scales to indicate psychological conditions. Scale 1, hypochondriasis. Scale 2, depression. Scale 3, hysteria. Scale 4, psychopathic deviant. Scale 5, masculinity and femininity. Scale 6, paranoia. Scale 7, psychoasthenia. I'm not even saying that correctly. Sorry about that.
Sure.
Scale 8, schizophrenia. Scale 9, hypomania, and scale 10, social introversion. How is this assessment given? It's administered individually or in groups, and computerized versions are available as well. It can be scored by computer or by hand, but results are always interpreted by a qualified mental health professional that has taken extensive training in the MMPI interpretation. And then the last question was, is the assessment widely used or narrowly focused on specific individuals or couples? And it's become one of the most widely used psychological assessments for individuals 18 years or older in clinics, hospitals, correctional facilities, and pre-employment screenings.
Very good. What got you interested in that?
Well, I did find another one that was actually used in Poland, and I thought that wouldn't be maybe appropriate to be used and that was for neurosis. It was very interesting, but so what got me interested was, I guess I was looking into something to do with my sister. I thought in the third section of our paper had to do with doing it with somebody, and she indicated she'd love something about personality. So I kind of went that direction.
Oh, good. Yeah, very good. Anybody have any questions? So that's the MMPI, and it's over personality, but it's got a lot of scales in it, doesn't it?
Yeah, it does. And there was a lot. I didn't go over the validity and the reliability. It commented on that too in the article. Yeah, there's an MMPI 2, MMPI RF, the 2LRF, and then an MMPI3. There's like 5 different versions of it too.
Do you know the difference in between them?
No,
Okay, that's okay. That's okay.
well, I can tell you that some of them have more questions and take longer to complete than others. That's a difference in them. I saw that, but I didn't go into the distinction of all of them.
Very good. So, and so what I would imagine is they all have different lengths to them or something, or one, two, three, four, maybe different reiterations of it or something. And the professionals will know, obviously. But so along those same lines, there's that dyadic adjustment scale that we went through. And then there's one that's a reduced form. I just wonder if that's what the RF means. I don't know. But it has a lot less questions on it. So like mine, that I showed you earlier at 32, the reduced form or whatever it is, I can't remember exactly what it is, but it has something like 10 questions or something. So um, so can we get to the same conclusion through a less number of questions? Yeah.
Yes. Yeah, because the MMPI2 contains 567 test items and takes 60 to 90 minutes to complete. So,
So 60 to 90 minutes and it has 567 questions.
yes,
So could you imagine taking that?
I can't. Yeah.
I'm actually 99.9% sure I took that.
Did you?
When we adopted our daughter, one of the requirements was a psychological evaluation.
Sure. Oh, absolutely.
And so I'm 99, this the number of questions. And there were lots of them that was the same question worded different ways.
Yes. Yes.
It might be a yes answer this time, but it's the same piece of information that's a no answer the next time, that kind of thing. No, it wasn't fun.
Did it take you 90 minutes?
Probably I was at the office probably 4 hours
Yeah.
because there was several components
Sure.
to the test. And some of them actually were fun, but that one wasn't.
Okay. I just can't imagine going through 600 questions, sitting there and doing it in a period of time and not getting frustrated.
Yeah.
So that's probably why they have some out there that are a lot less. And hopefully they come up with fairly the same amount, same conclusions. Good deal. Thanks, Susan. That was good. Any other things to add to it?
For me,
Yeah, anything you
just yeah, it interested me, but as I said earlier on, I just was concerned on how I would do a test like this with my sister when you have to buy it and you'd have to know how to interpret it, and have the training in it, and I don't have that, so that concerned me. That aspect concerned me when I decided to think about doing this. I'm not even sure if this is the one I'll do, but it seemed interesting to me.
Well, if it is, I mean, that's fine. And just, maybe like you said, like we talked about, just find a case study or something where somebody's already gone through it and
Okay.
we can work from there. I don't want you to have obviously not buy it and spend a lot of money getting trained on anything like that.
Okay.
Yeah. So let's just do that. Good job. I thank you for this. That's awesome. Who else has one? Who's next? Charlie.
Yeah, I'll go next if nobody else wants to.
Yep. Go for it.
I mentioned this morning I was interested in the strong interest survey.
Yes.
I started this new job this week as a career counselor, and the reason I thought about this, they do inventories here. I haven't learned what they are yet, but they help these young people kind of determine where they want to go in life.
Yeah, absolutely.
This is a job corps, so they're like setting them up to learn new trades and maybe go on even further than that, college and beyond, based on their own goals. But anyway, so the strong interest inventory thing I found was about basically it says it's a powerful method for matching the interests of an individual with opportunities for jobs, education, etc. So I thought that was kind of in line with what, and then I might also think about examining what exact assessment they use here as I learn about that. But really, one that really interests me that I'm not sure it wasn't on that list or anything, but I found a few things about. I basically I've told you all several times about how, in my experience, it's limited, it's anecdotal, but especially during the pandemic, I recognized a huge need with veterans and military members losing their identity. They were completely befuddled about, what does it even mean to be a soldier anymore? What does it mean to be a man? And we continue to get bombarded with that. And so I just basically typed in a search engine, is there anything, any kind of psychological assessment that measures one's sense of identity? And anyways, I found this one that's got a few items on it, not near as much as what I found on the Strong, but this is really interesting. It's called the Self-Concept and Identity Measure.
Hmm.
And it says that it's there's a lot of information here. I don't want to go into too much detail, but what was really interesting to me is it says identity dysfunction occurs amongst almost all diagnoses. And in fact, the new DSM-5 includes identity functioning as a key diagnostic feature of every personality disorder.
Wow.
So almost everything apparently can be affected by just that one item. And that, and like I said, based on my own experience, it really makes, I have a passion for it. It's like, sounds like there's something there that I could really use to help the niche that I'm interested in serving.
That's awesome. So
I guess I can email you
so you're talking about
information there.
so you were talking about identity, right?
Right.
It's like who are we once, but and even if we go through, so how important is it to have that relationship with God, and know our identity in Christ? I mean, you just said it right there. It's like it's along with every disorder in, so what if we have if we have that relationship with Christ, right?
Mm.
Can solve a lot of problems, can it?
Yeah, because it really isn't about who I am, it's about who I am in Christ.
Absolutely.
And I get that.
That
It's
was
just
good.
like, it seems like there's a pretty powerful tool there to say, okay, look, this is who you really are. You're definitely not who you think you are, or the piece of crap you think you are. But in the end, we're all just broken vessels that have lost that connection with that God intended us to have.
Yes.
But hey, there's good news. There's good news. He already made a way to reconnect.
Yep.
It's that three rings discipleship or evangelism thing I was talking about before.
Yeah.
It's just that same thing, but it's kind of like a good way to get people there. Like, okay, calm down. You're not. I doubt you're as bad as you think you are. Let's test this. Here's some real live data we can use to dispute your idea. It's like the ABCDE method you were talking about earlier.
Yeah.
Your beliefs aren't, but there's something to them, right? There's got to be. But the problem is that you're not who you're supposed to be, who God created you to be, because of sin and our broken world.
Yes.
This identifies that it's not just you; it's part of the situation you find yourself in. Now let's talk about the rescue, and then it becomes an evangelism tool.
I love that.
I don't know.
That is so good. Absolutely. Thanks for that. That's really good. Cool coat, by the way.
Oh, thank you. Stuckey's
Looks warm. Is what?
from Stuckey's, the gas station. There's one on I-70. They sell. There's like stacks of these, like $15, I think.
Well, there you go. I thought you
We
almost
got everybody some one for Christmas years ago.
that is I thought you said Bucky's at first.
Oh no, probably there too.
They're building one in Kansas City.
I heard.
Yeah. I've been to a couple of them. I went on the way to Texas and I've stopped at probably two or three of them. They're pretty cool.
Yeah, I stopped at a giant one in Dallas area once.
Yes, yep.
Yeah, they're huge.
Yeah, they are.
I
Well,
heard the one in the Kansas City area is going to be. I can't remember what they were saying. It was incredible what they told me. the size of this thing's supposed to be. It's like bigger than a mall.
74,000 square feet.
Is that what it is?
Yep, 74. I
Wow.
just heard that yesterday. 74,000 square feet.
Wow.
That's a lot. So Abundant Life Church is 100,000 square feet.
Really?
Yeah. So this is just a tidge smaller.
Right. And it's just a convenience store.
Yeah, that's it. Yeah. Yeah. It's very cool. Not to get off on Buc-ee's, but
Right.
fun to talk about. But so how can we assess Buc-ee's? That's what I want to know. Yeah.
It's all
That's good. Hey, thank you, sir. Hey, I can't wait to learn more about your paper. So if you do one that you don't give to somebody, put in that 3-ring thing that you were talking about.
right. Okay, yeah.
That's
Yeah,
really
that's a good
nice.
idea.
That's good. Thank you.
Thank you.
Yeah. All right, who's next?
I can go.
Okay.
I made a PowerPoint presentation.
Okay, let me share real quick. Thank
I
you.
didn't know if that's what we were supposed to do.
No, well, I think it's
Overachiever.
gonna be awesome. No, yeah, it's gonna be awesome. Let's do
It's not very long, but I just figured that's easy because I'm a visual person. So,
okay.
do I just click the share button on the bottom?
There you go.
Let's see.
Hopefully you can take it over. Hey, there we go.
Awesome. Let me just do that. This is so weird. I've never been the one to share the screen like this. Okay, so I was looking into doing the adverse childhood experiences, or known as ACE. So the CDC describes it as the adverse childhood experiences are potentially traumatic events that occur in childhood from basically birth up until 17 years old. So just a little bit of information about it. So the ACE test was developed by two individuals, Dr. Robert Anda and then Vincent Felitti, I think is how you pronounce his name, in the early 1990s. So it really isn't a test that's super old. So the study was, a big study was conducted over it with about 17,000 participants, which was, a pretty significant number, but it was funded by the CDC utilizing that questionnaire specifically. Another quote, the CDC and the Kaiser Permanente Adverse Childhood Experiences Study is one of the largest investigations of childhood abuse and neglect, household challenges, later life health, and well-being.
Wow.
So
That's good.
implications of the questionnaire can help individuals, professionals, researchers, and the alike identify different areas of trauma from childhood, just to help inform mental health services, maybe community programs, things like that, to decrease risk and provide preventative measures.
That's good.
So whenever I was first interested in learning about it, I was actually really caught off guard. I thought there would be a lot more to the assessment itself. Like the word that they use is less of assessment, more like questionnaire. So in the link, there's only 10 questions on it, but it is 3 specific categories that is identified. So between abuse, it looks at emotional, physical, and sexual abuse. Neglect focuses on the emotional and physical components, and then household challenges are things like a child would have witnessed. So maybe domestic violence between the parents, substance abuse in the household. So were any adults, maybe other children that were older, were they utilizing any substances? Mental illness in household. So again, not necessarily pertaining to the child, but maybe another adult or family member there that had any mental illness diagnosis. And then, of course, parental separation or divorce, and then an incarcerated household member. So the assessment itself actually can be found online. I was able to just search it and I had no problem with finding it. So, it has access for anyone to basically take. I definitely need to do more research behind that. But because of the open access to the questionnaire, I presume a lot of people probably just take it on their own without having it being recommended by a counselor or some other professional, which can be helpful to be like, yes, I kind of identified those things, or I did experience this, but I wasn't sure what that looked like. But I can see where if they don't have a counselor or other professionals guide them through what those results mean, then it could be, yeah, like complications could come from that. So it can be beneficial though for those seeking individual, couples, or family counseling and just understanding their childhood trauma. It is completed primarily by adults, but again, because of the open access, I bet there are a lot of children or teens that complete the questionnaire just to maybe identify any areas of trauma that they have or maybe are currently witnessing at this time.
It's good.
So what does it measure? To score the questionnaire, the individuals will mark a tally next to each question that it pertains. So the higher the score, the greater the risk they are of having those experiences. Just, yeah, through the traumatic events. Demographics, so age, gender, race, socioeconomic status, maybe the length of exposure, just different components to it are important to consider in terms of its prevalence for different groups of people that may be at higher risk of being predisposed to ACEs. So yeah, maybe kind of identifying different places. There might be worse places in Kansas City where that might be groups of people that experience it more than other areas. Another quote I found, the ACE study has uncovered how ACEs are strongly related to the development of risk factors for disease and well-being throughout the life course. So basically what that just means is the assessment provides its information based on the statistics and data that was gathered throughout the time of the biggest study was conducted to now. Just the link between our adult health with those traumatic experiences in childhood. So, yep, they're linked to different mental health disorders, our physical health problems, an increase in suicide ideation or attempts, and then substance use and alcohol abuse.
That's good.
So I also found this too. I thought it was kind of cool. The CDC, since they were a part of one of the original studies for it, this was just kind of some of the things that they were stating that they were doing specifically. So in ways to help creating a safe, stable, nurturing relationships and environments for all children, prevent ACEs, and help all children reach their full potential. These relationships and environments are essential to creating positive childhood experiences. We all have a role to play. So what they're stating that they're doing in their strategic goals is to support ACEs surveillance and data innovation, expand what we know about evidence-based ACEs, prevention, and positive childhood experiences promotion, build a local, state, tribal, and key partner capacity, and then increase awareness and understanding among key partners. And then I kind of threw in my own thing, like what is it that we can do as believers, as family units, as a community where we are located to be able to help with these things. I currently get to work with teenagers, and of course, these are things that I do hear often. So that was kind of why I was interested in learning more about that, because I am with them in the thick of it before they even get to their adult years. And so whatever we can do now to help them work through some of the things that they're witnessing is definitely important.
So where do you work at?
So I currently work for a community mental health place. It's called Comprehensive Mental Health Services. It's located in Independence, but I'm a part of our school-based team. So I actually am in partnership with the Green Valley School District. So I get to go to that building and visit with my kiddos there. So we have like providers in different school buildings across the Missouri side of Kansas City.
Oh, great. That's awesome.
Yeah. So I think that is it. Oh, I did add this too. I almost forgot about that. So this was like their ACE pyramid. I just thought that this would be a cool graphic to show. So kind of just showing how historical trauma, how we often call them like generational curses or things like that, how these things can start to build the basis of what our experiences look like. So if the parents experience things that were unresolved in their life, then they might be the ones to then continue it forward. The adverse childhood experience starts to happen for our client as a child that we're trying to figure out. Then it then continues to build on each other. So then we might start to see social, emotional, and cognitive functioning delays that further go into their health risk and behaviors, then disease, disabilities, other social problems, and then early death could be possible. Again, going back to the increased risk of suicide ideation and attempts. and then it could be followed through. So this was just, yeah, a chart that they had on their site that I thought was really interesting just to add to it. So,
That's good.
yep.
Yeah, go back to what you just had, the references.
Oh,
So, okay. That's good. Good job. Who has questions or thoughts?
do you know how I stop sharing the screen? Oh,
I
wait.
really, oh, you're good.
Oh, there
I
we go.
really appreciate you sharing about that. I think super, what? Sorry.
No, you're good.
Okay, I thought you were going to say something. I really appreciate you sharing that because I think that is super important aspect. And even like so in high school, I used the ACE I was doing a project on like how schools can, or how specifically my school, Lee Summit, could create prevention, intervention, and postvention measures for suicide
Cool.
in adolescence. And so I did that project in high school, like as whatever presentation kind of thing that I was doing. It was a big research thing. And I sent out this questionnaire that had the 10 ACEs with the permission of the like school counselor and everything, to kids from each grade, and got like this whole data set about what the average ACE score was of a kid at Lee Summit High School. And it
That's
was
good.
uh, minimum of 3 and an average of 3 to 5, with some kids having some higher, but that kind of ended up being in the middle. So it followed the bell curve perfectly, quite honestly. But I think this is super important because it does help inform schools and it helps inform programs in terms of like what I was trying to help develop, which was, intervention, postvention, prevention efforts for suicidality. Because there was that was the other questions that we were asking was, have you ever thought about suicide? How often have you thought about suicide? Have you ever come up with a plan? So those were part of the questions as well. So we were trying to develop the correlation between suicidality and ACE scores. And there was a pretty high connection there between a higher ACE score, even in our little tiny population. And I think I got about 250 data points out of it. So anyway, I get super nerdy about it, so I'm glad you're doing it. It's really cool. And I like your share. We have a very shared passion for trauma and kids, I think. That's cool.
Absolutely. Thank you for sharing that. Yeah, I think you definitely made a great point there too of the connection between suicide and the ACE scores. The majority of who would partake in it is pertaining to adults to kind of evaluate their childhood experiences there, of course. But I think the bigger question is why are we waiting until they're in adulthood to monitor what are their experiences like? Again, if we can start to recognize these things before it gets serious, because I think there has been an increase in just teenage suicide attempts and it actually being carried out. So it's really devastating, but hopefully we can, just allow this to help us navigate how we can do better as a community when it comes down specifically to families in general, because that's really what's focused about. What is the family dynamic? So I know when we were kind of talking about the family history, Doug, I didn't know if that would maybe be something if when in the intake process, if whenever our clients are maybe sharing some information, maybe that questionnaire could be a good thing to help them
Oh,
further. For sure, these were actual traumatic events, because on the flip side, the nuance, sometimes the word trauma gets thrown out without people actually utilizing it the correct way. Especially a lot of teens do. They just say, like, I had trauma or something, even though they're talking about like forgetting like their notebook or something to class. Like it just, things are just shared carelessly rather than with intentionality. And so just being very specific about that. But yeah, that's kind of my thoughts on it.
That is so good. Absolutely. And you said there's only 10 questions on it.
Yeah, there's only 10, so it would not take anyone very long to get through. I'm actually a little nervous on how much information I will be able to get for this paper. So If it's okay, I actually thought it'd be cool to maybe add a section, maybe talking about like the biblical components about just
Yes.
and just kind of doing that. I know in our research class, part of the paper we had to do for that was just kind of talk about how that relates to our topic, like what scripture says about it. So maybe to fill up some space.
Everybody, I would love you guys to do that aspect of it. Absolutely. Yeah. No, any place that we can integrate our values, beliefs, all that stuff into what we're doing, that is part of assessments. Yeah, absolutely. That's so good. Or even, what it would be awesome to see is like you have those 10 questions on there. As a believer, what questions would you add? Or even maybe how would you reform those a little bit from a Christian worldview or something? I love
It's
that.
interesting you say that. When I was the guidance counselor at an area Christian school, I was certified to give Strongs or trained in it, whatever you want to call it. So I gave Strongs to my students and also a spiritual gift inventory.
Yeah.
And then they took it and then they came back and went over it with me. And then I gave them the results. And the next time we met, they had to come up with some career choices that aligned both with their interest from Strong's as well as their spiritual gifts.
That's good. I like that exercise. So you did that with how old were they?
They were most of them were seniors.
Oh, good.
With some like who are really vested in their future, I would start at their junior year. But most of the time I started it early their senior year.
That's so good. So I used to have this Excel spreadsheet that had how to determine spiritual gifts. Anybody have like a spiritual gifts taker? I know there's probably some out on the internet, but anybody have anything like that?
I don't have it anymore. I used one that was published by Lifeway.
I
Yeah.
do.
Who does? What now? Felicia?
I was just saying, I have I got something offline for spiritual gifts
Do you?
that I use for when I do a discipleship class.
Yeah. How many questions is on it?
A foundational. It's about like 25, I think it was. But yeah, it's not that long. But it was really good and it's really helpful for somebody who's just getting in the church and they're trying to figure out where do I even need to start to be active in ministry. So
I love that.
I like using it to I tell them it's not foolproof, but I said people will see, that it, what it's saying, if it's correct, they'll confirm it. The
Yes.
people in the body.
So if you have that, you think you can send it to me if you have it handy? Maybe we can put it
I'm
out.
gonna run it and see if I can find it. If I can, I'll try to get it to you.
Yeah.
Yes, sir.
And I could put it out on Canvas and stuff like that. Yeah.
Okay.
That's awesome. Thank you.
I
Lauren?
think Abundant Life has one. I cannot remember what it's called, but I remember taking it like 4 years
Yeah.
when I first came there. So
Yeah, I know. Yeah, exactly. I was going to ask it.
It's called the shape test.
What's
that's
it
what it
called?
is. Thank you.
What's it
It's
called?
the shape test.
Okay.
Shape, SHAPE. It's an acronym for something, but it's a personality test, but it also talks about spiritual gifts. There was a link to it somewhere when I was on staff.
Yeah.
I think it was in some portal that we had access to. I don't remember.
Yeah.
But
And it may be out on their internet too. I haven't been through the whole thing, but we'll see if we can't find it. That's good. All right. Who's next? So we've had three, right? So we got three more.
I'll be honest with you, I have not started, so
Okay.
I will get on.
Cindy, you're muted.
Forgot I muted it. I just saw the assignment after y'all started doing it. I was like, what are they talking about? So I went back through the email and realized I hadn't even seen it. So I'll have to do it tomorrow.
Me
Okay,
too.
that sounds good. That sounds good.
I can go ahead and do mine.
Okay, sounds good. Do you need me to share it?
I've already kind of talked about it a little bit, so like I don't, but I'll go into detail. I have a little tiny slideshow, but like it's just writing and I'm gonna say all the words. So it's not nearly as pretty as Lauren's, I have
Oh,
to say. I have 10 out of 10 recommended.
so put it up. Let's see it then.
Okay, okay, I will. That's fine. Um, give me 1 second.
All right, I like it. Like it already.
Okay, can you guys see it?
Yes.
Okay. I'm not looking directly at the camera because my slideshow's here and the camera's here. But
Oh, you're fine.
so it's the Gottman Marriage Assessment. Um, the Gottman Marriage Assessment was created by the Gottmans. Go figure, kind of crazy. It's by John Gottman and Dr. Julie Schwartz Gottman. They've been married for many years. Like Doug was saying, they created what's called the Love Lab, where they went through and figured out all of the different factors which contribute to someone's divorce. And they have 4 principles. They call them the 4 horsemen of the apocalypse. The 4 horsemen: criticism, defensiveness, contempt, stonewalling. And then they've added recently their cousins, which are belligerence and then domineering pieces as well. So in their book, they kind of go over the book is up there, but go over the various different like aspects of what make a healthy marriage and what their findings were from their love lab. But then they developed this really cool 3-tiered training system for professionals to equip counselors on effective marriage therapy. And it's a very structured method. And there's actually assessments in each of the 3 tiers. I'm honored enough to be able to work with some really amazing counselors who are already certified in Gottman, and so they kind of just handed me their manuals.
Well,
So I I'm only going to do for this class the stage 1 assessment, but there are similar types of assessments throughout the entire program. The big one, though, is that very first one that you do at the beginning of the program. Um, so who or what is it created for and what does it do? The assessment was created, like I said, for counselors to use in their beginning steps of their overall counseling process. That when I say assessment, I mean those first 3 stages that I mentioned earlier. It's
so,
supposed, yeah.
so when they do they give that to them before they even come in and they have these assessments done, or do they meet with them first?
Yeah, so Gottman calls the assessment the first 4 sessions. They call that whole process the assessment process.
Oh, okay.
So, and I think I have oh, you know what? I don't know where oh, there it is. So it's given over 3 or 4 sessions. Session 1 is going to be the couples interview. And in the couples interview, they are assessing, it's more of you ask a bunch of really open-ended questions. You ask about repair attempts, pursue and distance patterns, how they influence each other, do they compromise with each other, how do they de-escalate, what is humor like. It's extremely like in depth. And then they also create a conflict in front of you. So as a counselor, you ask them what's a conflicting conversation that you guys would have, and then you guys are gonna just duke it out in front of me without me saying anything to you for 10 minutes. And then I will stop you and we'll de-escalate in the session if we need to. And then they ask a bunch of other qualitative information. Mostly, they watch to see how, what are the physiological responses of the couple when they're engaging with each other? How close do they sit together? I mean, it is extremely, extremely extensive. So that's the very first session. That would be what you would do as either your first session. Sometimes the counselors will do like a typical intake session just kind of overview of everything that we kind of talked about in the biopsychosocial assessment. And then they'll say, based on that assessment, they'll say, okay, I think we need to do Gottman method. And so then during the second session,
Okay.
officially, they would do this
Okay.
first step.
Thank you. That's awesome. Yes.
And then the second session is going over together the written and online assessment results in minor detail until they can then, and just kind of to get reflections, to kind of get the feel for what it is. Really, this step is mostly just the counselor's side of things. It's a lot of prep work. Like our Gottman counselors will sit for a couple hours sometimes just to read the results and understand in detail what what are the dynamics of this couple. And then they'll kind of talk about some of those points or any of the questions or stuck points that they may have during that second session. And then during session 3/4, it's split up and you do another very strategic questions of individual interviews. So you'll do one session with the husband and then one session with the wife, or you can split your session in half and do just 30 minutes with one and 30 minutes with the other. And then after that, following that session, you develop the treatment plan and you develop the interventions that you think would be appropriate for the client, the couple, and then give them their first homework assignment, which is often something about what Gottman calls the love house or the relationship house, which I should have put a picture of it, but I have it right here. Let's see if I can pull it. My fingers. So this is the sound relationship. Can you see me? Yeah, yeah. Sound relationship house. It's probably hard to see. But the walls are commitment and trust with a foundation of relationship. So like the relationship is held together by commitment and trust on the sides.
Yeah.
And then they have various different stages in the middle, talking about creating shared meaning, making life dreams come true, managing conflict, positive perspective towards each other, turn towards each other instead of away, sharing fondness and admiration, and then understanding each other's worlds and perspective taking. So that's all step one. The written assessment has about 700 questions
Wow.
in it. So it's kind of crazy, actually. And so I do think, though, I have the physical copy. I'm kind of thinking, based on what I've heard, the online version has been pared down since the version that I have, to kind of be splitting it so that there's I think 300 questions for the wife and 350 questions for the wife, 350 questions for the husband.
Wow.
Or split up in some form or fashion. I said C manual because it's really hard to describe. Essentially, during the written questionnaire, there's a bunch of mini assessments. So there's like the Locke-Wallace relationship adjustment test, the Weiss-Soreto relationship survey inventory, the sound relationship questionnaire, the Gottman, there's a ton of these other super, all the way down to an assessment about suicidality in relationships, an assessment about incarceration in relationships. So it is super, 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 super detailed. But it's mostly all Likert scale or multiple choice is the form of the questions and the way that they show. Like I said, qualitative, quantitative information.
Yes.
This is specifically in a marriage, or Gottman likes to clarify cohabiting people also, which is true. And I think that there is an aspect of that where couples do call in all the time to the counseling office who are not married and who are living together, which as a Christian, it's really hard to internally be like, should I see them? Right? They're not even living together. They're living together and they're not even married. How, there's your first problem. right? But they don't see it. And
Right.
so doing an assessment like this could help them see your likelihood based on science, literal science, the likelihood of you guys getting divorced is pretty high.
Mhm.
Um, or you guys are actually really perfect together. Just freaking get married, right? Like, so it actually can be a super encouraging thing in either the direction of y'all need to split up or you guys need to you just lean into the fact that you're good for each other and you need to just get married. And so that's one thing that my eyes have kind of been open to and become more like aware of from a biblical perspective. The other like limitation of this assessment that I can tell to is Gottman in more recent years has gone to being talking about, you know, how this information is accurate, even crossing like gay and lesbian and trans relationships. And that is, obviously not biblical.
Right.
We don't approve of that. And so there are biblical principles there which would suggest that you're probably still missing something, even if you end up with a high Gottman score and you're lesbian, right?
Mhm.
You have a high Gottman score, you're lesbian, and you're still miserable. Why?
Yeah.
And that's a very blunt way to say it. I'm sorry.
Yeah.
But there are pieces of there where God just created it a certain way. God created marriage to function a certain way, and that's where this assessment actually shines is because
Mhm.
perspective taking, building connections with each other, trying to understand each other, trying to, be quick to listen and slow to speak. Sharing created meaning around a thing like religion or faith or whatever is all biblical. So that's where they shine. But then they also kind of like the one downside, major downside is that they're very endorsing of a non-biblical worldview in terms of marriage. So anyway, like I said, it was a little bitty presentation guy.
This was very good. Thank you.
I thoroughly enjoyed Lauren's adorable kids slides, but
Of course, of course.
I don't know how
But
to start presenting. Oh, there it goes.
so, Maddie, yeah, I get what you're saying and everything too. And the beauty of all this is, um, we even talked about it in Helping Skills. It's like, Carl Rogers has person-centered theory and all that stuff too. My deal is all of these people are taking biblical principles, but then they incorporate this other stuff into it. And it is tough to swallow sometimes. So it's almost like and what I loved about it is like, so it was you, Lauren, who said, "Hey, I'm writing my paper. I'm finding, there's some space to include this biblical aspect of it." And I encourage all of y'all to do that, right? Because we can take stuff that is created by others and incorporate or integrate all of these, these biblical aspects into it. And I would say that it's an opportunity. I would always say um, it's an opportunity to be able to incorporate that into what people have uh, created. What's your guys' thoughts on that?
Common grace in action.
Say what?
Common grace in action.
Oh, absolutely. Oh, yeah, absolutely. Yep. Thank you for that. Absolutely. Yep. I've got a whole section on that in my paper. It's common grades and everything. Yep. It sure is. I'm telling you. Thank God. Does anybody else have anything? Maddie, that was awesome. I love Gottman stuff, and I know what you included at the very end. I get that because they do talk heavily about that sometimes the aspect of it. So
Yeah.
I
I
get
mean,
it.
it's so good. Like they are just so spot on, right? Because that's
Mhm.
that actual revelation piece of like God can if all truth is God's truth. So this truth is studied and analyzed, and they're missing an interpretation piece of it, but for the most part, it's pretty spot on. So
Hmm. Yeah, absolutely. Yeah, that's good. Yeah, I mean, they did from that book, when that book was created, the Seven Principles, I think they had done 40, he had done 40 years of research. So now it's 50 some years of research behind all of this stuff too. And I mean, he knows what he's talking about. And his wife is with him, so they're in partnership. So it's pretty good. And he's funny too. He's a funny guy. He's not dry or anything. He's pretty good. Does anybody else have anything? Okay, so we are heading into it. Why don't we take a like 10 minutes, come back at 3 o'clock, and then we'll finish out today. Okay, so chapter 3, it's pretty much about talking about standards and you know, people creating tests, things like that. Okay. Okay, so standards and guidelines for evaluating tests. So creating tests, so they have to have standards that are created so that nobody's just creating tests that mean nothing or don't have reliability or validity or anything like that too. So who does those? So several standards and guidelines are available concerning the development and use of psychological assessment procedures. So the ACA Code of Ethics is one. So when people are creating assessments or evaluations or anything like that that people can use, they want to make sure that it's part that's, you know, it's got guidelines backed by, you know, a professional um, code of ethics, right? So the ACA Code of Ethics is probably the most widely used one. NBCC has a code of ethics. Um, the American, you know, well, the AACC, believe it is, has their code of ethics, and pretty much they try to all, you know, stay around kind of consistently about what their ethics are with each other. Of course, is do no harm, things like that to your clients, but there is a little bit of difference in them. So standards for educational and psychological testing, they have things that where you have to run through. If something's going to be used with youths, it has to be ran through some of these other types of standards. Okay. Another one, a joint committee on testing practices documents that to help people um, with it, you know, responsible test use, rights and responsibilities of the test takers. So just like in counseling, the people who are getting counseled have rights, the rights to understand the code of ethics, the rights to understand privacy and confidentiality and things like that. So even with test taking, you have rights that you should understand before even taking the test. Who's going to see it? Who's going to where did this test come from? You know, how was it created? Who's it created for? Things like that. Code of fair testing practices and education, you know, for students, things like that. Standards of qualification for test users. So you're seeing here, there's just a lot of, that's where they were using the word rigorous before. So these are part of the rigors, right? That what makes it rigorous, that you have these standards that you live by, and so that that you are creating something where harm will not be done. Okay. Standards and guidelines for evaluating tests and test usage, responsibilities of the users for standardized tests, so on. So how about specialty assessment standards? So career counseling assessments and evaluation competencies there. So they're then it's even getting more specific down to career counseling, marriage and couple and family counseling, mental health, substance abuse, pre-employment testing, and the ADA. So they all have standards and guidelines that help them when people are creating and how to give tests and take them and so on. Okay, overview of the assessment process. Assessment of client's stage of change. Remember, we talked about this a little bit about um, we're assessing where are they at in their stage of change, right? Pre-contemplation, contemplation, preparation, action, maintenance. Where are they at in that? How can we move them through these stages of change with assessments? Okay. Four major types of assessment phases. So test selection, we kind of went through this earlier. Administration, and interpreting what the test means, how can we put that into treatment plans? How do we assess what we've learned through it? And then how do we communicate these findings or put them into treatment plans so that we have a plan moving forward for care? Key ethical and legal considerations in assessments. Counselor competence. So is the person, we talked about this a little bit earlier. Let me kind of bring you guys up here. When Susan was talking about the MMPI and saying, hey, I have to purchase this, and then there's some tests out there that you can't purchase unless you give them your license. And so they want to make sure that you understand, or maybe you have to go get education on it to be able to administer it so that you aren't creating harm or interpreting the results wrongly or things like that too. So counselor competence and testings, there's competency levels, A, B, C, and Q. Not sure, established by test publishers. I'm not sure what those levels mean. Could go out and look. So all states recognize counselors as having testing and assessment within the scope of their practice, but various licensure boards may try and restrict rights. That's where it may come down to maybe only psychologists can give a certain type of test. There's like stuff that what Maddie was talking about with Gottman. Even people who are lay counselors can, give that. People who maybe work at a church that they can give some forms of that, but not all forms of it, right? So, it's like Prepare and Enrich. They don't really want anybody giving those assessments unless they're trained in that. So, like at Abundant Life, we'll do the training for Prepare and Enrich, and they get you certified. So and then you're part of their membership team and you can purchase assessments through them then. But they don't really want you purchasing assessments unless you're licensed and have been through the training. Client welfare issues, client privacy and confidentiality, quality of the test interpretation. That's where it all comes from training, right? And getting you used to what the answers are on that and how to interpret them. And use of assessment data and research. Anybody know what that means? Okay. Use of assessment data and research. So what if this is just part. But what if you have some form of assessment that's out there and you collect data, and then that data can be released to researchers, and so that they can put together research, may even make the test better, create different tests from it, write research papers for people to be able to access and learn more about it. So it's good, and it doesn't there's no names on it or anything like that. So I'm writing a paper and I've interviewed 25 people on it and may do more. But that research that I'm doing is going into this paper. There's no names on it or anything like that. And hopefully what I've done will contribute to what other people do in the future. So that's one way of kind of looking at the data behind the research and everything, and how people can use that to create better things. So just like we talked about earlier, the lobotomy, right? So at that time, they felt like that was the best course of action for people to get better. Obviously, we know that that's wrong, but a lot of research went into proving that wrong, right? And so now we have people who they don't do lobotomies, but they do other things that can change the way your brain operates. Like just like EMDR can change, through bilateral stimulation and things like that too, can change the way your neural pathways communicate with each other, things like that. So it's all of this research has gone into understanding um, through assessments, understanding better how we function, behavior, all of those things, so that we can get better and better at our creating. Not going to go through this because you guys are either going to go through it in your research class or have gone through it. But it's pretty interesting. So then we get into professional issues in assessment, so testing and technology. So increasingly used in giving multiple benefits. So testing and technology. So I think we've come a long way in technology. I love it, but I also like the human aspect of everything. So I'm always on the fence with, I like the technology, the speed of it and things like that too, but I don't want to take the human connection out of things. Counseling process issues, findings to be shared in a manner to benefit client. Let me see what this is. Client self-awareness and decision making, validity considerations, test anxiety. Here's another one. So think about this: relationships between anxiety and scores. I'm going to give you an example. So giving a DISC test. So DISC is DISC, which there's 4 quadrants in there. They all relate to personality types. Okay. So I used to give this DISC test to people coming in, and they were, they were looking for a job and things like that too. And so I would give them this to kind of see, okay, what's your personality type and things like that too. It got to the point where I had given, I don't know how many of them, but I got pretty good at being able to guess what their scores were. And so I would kind of make a game of it before, just by talking with them for 15, 20 minutes. What is their score going to be on this? And so one day a person comes in, and I had talked to her probably for an hour, and then she took the DISC test. But I said, okay, she's this. So I wrote it down. She comes back, and it wasn't even anywhere close to what I was thinking. But but the way that she was talking to me and everything she was saying would lend itself to what I had written down. So just by observing and all that. So I asked a couple of questions. I'm like, man, this is just puzzling. And then I got to thinking, I go, has there been anything in your life recently that's happened that is significant? And she goes, yeah, my husband just left me. I've got a 1-year-old baby that I got to take care of. He's left. I can't find him anywhere. So he's not taking care of us at all. And I have to get a job, and I have no family around here. Just all of these things. And I'm like, oh, that totally makes sense. So when she was answering these questions, she was answering them from a survival mode, right? Of I have to get this job. I have to do these things. And it made a huge difference. So that wasn't test anxiety, but she was answering them from a place of survival. And it totally made it different. So anyway, just finding different aspects. So if she were to find a job, maybe, be in a different relationship and everything was more, she was more safe, secure, I bet, the answers to these things would be different, right? So we always have to take into consideration what's going on in the person's life. Maybe it's a multicultural thing that's going on. So we do have considerations that we have to take into consideration. So, okay, let's see. So testing, even we talked about test anxiety, people can be taken and when, they are taking this disc, I just say, hey, take it as you view yourself, not as you feel others view you, because you're going to skew it if you don't. So, and then people can have anxiety and that may, cause blocks or whatever. Okay. Okay. Anything here? Mhm. Yeah, I think we're good there. Okay. Um, let's see here. What we want to cover. So a little bit, we'll just go through this a little bit. So multicultural assessment. So process by which counselors consider how multiple cultural variables influence how client concerns are expressed, conceptualized, and treated in counseling. I think, just taking it's, looking at from our own perspective and our own worldview, when somebody comes in from a different worldview, what does that look like, right? So, um, let's see, single most omitted step in providing culturally relevant services. Looks like on page 8. Let's see what that says here. Submitted. Mhm. Not sure what they're looking at there. Okay. So we talked about, or we looked at this a little bit before, standard deviation and things like that in test taking. Then Maddie talked about, something being within the bell curve, of answer, of findings. Um, I saw this and I didn't, this is part of the person who wrote the book put this in there, and it is just kind of saying, taking into consideration um, different things like so at the bottom that's a duck-billed platypus, right? So it is all kinds of different things. It's a mammal, it has eggs, it's just a different animal, of course. But then you got different classifications, reptiles, birds, mammals, and things like that. But it seems like it's part of all of them. So just taking into consideration, you know, um, what exactly, what you're seeing, um, and assessing for, and I'm not so sure what that is, but I just saw this and I'm like going, wow, that doesn't have good representation of the animal being all things, but then you have different classifications. So could be some parts be in all of the classifications. Anyway, so multicultural and social justice counseling competencies for development domains, counselors, self-awareness. So being self-aware of when you are giving assessments of who you are, what your culture is, and then counseling the relationship. That to me is like the most important thing is you can have different multicultural aspects and everything too, but what is your relationship? Remember, we talked about building that therapeutic alliance and building trust. And just like Maddie was talking about with Gottman, there's trust and what's the other one? What was the second pillar? What was it?
Sorry, commitment.
Commitment. Okay, so you got those two pillars. And so, in the counseling, having that trust built and, and we talked about it earlier, is how's that being built? Is through genuineness, authenticity. Thanks, Susan. We were talking about that. What's the client worldview? Counseling and advocacy interventions. How do we work with them? And what, really comes down to what are our competencies to do it as well. Let's see here. Fairness and culture bias and assessments, efforts to create equitable experiences for test takers free from bias. So bias, score differences or differences in findings that lead to differential ways of using the data. So not using the data in a way that you want to prove. So that's kind of like confirmation bias, right? So, or a bias as I want to prove something, so I'm going to take only the information that helps me to prove what I need it to, right? And a lot of research, you really got to be, and you probably learned that in your research class if you've taken that one, is being able to how do you stay free from that? Qualitative, and there's quantitative would be a way that you can use numbers and it is what it is. So that might be the better way of doing it rather than qualitative. But so a few assessments have been comprehensively vetted for culturally diverse clientele, leading to biased findings that yield ineffective and likely negative treatment outcomes. Here's one thing that as I was taking the NCE, well, if you guys take that test, think about it when you take it. But I was looking at it going, I went through school, this university, and learned all the core classes and everything to learned how to take the test and all that stuff too. And I got to thinking about it when I was reading the questions on this test. I'm like going, what? This is written for a person like myself. What if there's somebody who doesn't have the same, even regionally, doesn't have the same maybe educational education opportunities that I've had, all of these things, right? So going into it, or what if somebody's from a different country or whatever, and they're coming in, English is their second language and things like that too. Everybody didn't matter who you were taking this one test to determine if you can get a license or not. So I don't know. What are your guys' thoughts on something like that?
I think it's probably a very real concern, depending again, depending on the person and what their background, and it really could affect how they read the question or how they understand the question. If it's a situation they have to figure out and it's related to a certain experience, if they haven't had that experience, then they're going to answer different than someone who has. And so, yeah, it can all, it kind of, when you have, and I think Cindy spoke to this earlier, the standardized testing thing sometimes it can be unfair depending on who is taking the test.
Yes, very good, Felicia. That's awesome. Yeah. And so I was looking at it from many, many different levels, and I'm sorry, I'm just taking the NCE for an example. Nothing against it or anything. I just, had concern. Is it accessible the way it is for me for others? to be able to take it in a way that it's understood. Because to me, I was taking it, it was hard to understand in the first place, But the thing is they don't tell you how to go about and study. And there's a lot of people out there who have created study tests and ways to study for it and things like that too. But it's a standardized test, but there's no standard way of preparing for it, if that makes sense. So what if you're the university that you go to, um, you know, are they preparing you in the right way to take that, right? And that's what, these classes are for, is to be able to take these and understand, what an assessment is, what, theories are, and all of those things, so that you can. But then the real work comes after you graduate and before you take the test, is you're studying other things, right? There's, Rosenthal has one. There's many other. NCMHE has study guides and all that stuff too. But what's the best one to use, right? After you've learned the core part of it, the small part, what's the best thing to use after that? So anyway, I don't know. I just thought about that in the test that you'd be taking for licensure. Are there adequate study guides and things like that out there that help even the person who is using English as a second language, as an example, or just different ways that people learn as well. So me, when I was taking the test, I went through and there was this book I read, and it's called the Encyclopedia of Counseling. It's pretty good. It's got, I think, 16 different chapters or whatever. I did that. And then there were some CDs that you take, and there were probably 12 CDs, and I listened to that. And then I wrote out all of my notes, highlighted all my notes, and then I wrote out all the notes that I highlighted. And so I did it and I had everything covered on the ways that you learn, right? So I, learn through hearing, learn through doing, learn through seeing. So I had all of those covered, and I think it really helped a lot in going to take the test. But anyway, so just like, these assessments, are they culturally proven to be good for everyone? Or are there different cultures that you should take different tests for? Does that make sense? Am I making sense, guys? Okay. Okay. So a fairness in an assessment, for it to be fair, there is absence of bias. There is equitable treatment of all test takers. So once you do come up with an assessment, there's equitable treatment. Oh, I'm sorry. I was reading that. There's equitable treatment of all test takers. Like you all have it's all standardized, meaning you go through and they're all taking the same, they're taking this test through the same process and so on. Those with equal standing on particular test construct should score equally no matter the group membership. Test takers have an equal opportunity to learn and understand the assessment. Okay, cultural factors in assessment. Counselors are to process with their clients who should be a part of the assessment process. 3 levels of the client-counselor relationship to foster a positive working alliance is conceptual, behavioral, and cultural. Discrimination equals when counselors are cultural group membership to explain assessment findings. So being able to cultural group membership to explain assessment findings.
Is that like generalization of, so
Yeah,
that's all blacks do this, or all
Yeah.
Caucasians do this, or all, is that what you're meaning by that?
yes, that's what discriminate. Yes, exactly. Yep. Perfect. Thank you. I was just reading through all 3 of those. Diagnostic errors can occur when counselors misdiagnose, overdiagnose and underdiagnose culturally diverse clientele. Diagnoses are disproportionately higher for racial, ethnic minorities and other marginalized cultural groups. I think it's just really goes back to when we remember we took the multicultural class, and I told you this story of I went to this, I was a member of this church and didn't speak a lick of Spanish, right? But I became part of the Spanish ministry. So imagine that, because I'm sitting there not knowing Spanish. I play drums in it, and they're talking, and I had no clue what they're saying. So what did I do? I wanted to understand them better. And, and God bless them, they would come to me afterwards and try to speak English, and some of them just didn't know. So I'm like, I'm going to meet them where they're at because they're trying to meet me where I'm at. So I went out and kind of learned as much Spanish as I could. And just to see them, me speaking Spanish to them and making an effort to learn their culture. And I'd go over to their house and I'd say, hey, let's do all of this as culturally as possible. Help me to learn about your culture and everything. So that's what we should do as counselors too. If we're um, serving a population, to learn about that so that we can administer assessments in a proper way too. And as we diagnose and things like that too. What are your guys' thoughts on that? This is a tough part. Go ahead, Felicia.
Oh, I was gonna say that. Yeah, that's a good idea. Like I said, me being in a mostly Kenyan congregation, I'm
Yes.
trying my best to learn little things here and there and ask them questions about their culture um and so trying to meet them where because they most of them know English, but it's helpful. We do have one guy that's from Colombia.
Mm-hmm.
We try to put when we do like praise and worship, even when we do on the screen, sometimes we'll have Swahili words, but we'll also include words Spanish for him to be able to know what's going on um, as well. So
Yeah. So he feels what?
yeah, he feels welcome.
It included. Yeah, absolutely. Very good.
I ask a question though, because this says diagnosis is disproportionately higher for racial and ethnic minorities. Is it because uh, many in from a lot of people, a lot of counselors are not of multi different races?
Yes. Yes.
Less, I know this is not very many African Americans, definitely not African American males, and not very many African American women. As far as like other racial groups represented as uh, uh, counselors,
Yes.
that may be you think that might be why that
Absolutely.
is race that is so much higher.
Yeah. So, and let's look at it in another way too. I'm so glad you brought that up. So, look at it another way too. So, let's think about as we saw that timeline of how assessments developed and everything too over time. And then you get to, so that dyadic adjustment scale was made in the 70s. Well, then there's been other things that have come, love languages, all of these things. So you can see over time, things have developed in a better way. And so, yes, I think there's less culturally diverse individuals in counseling. So that would be one aspect of it. And the other aspect of is, I believe, for me, is there was stigma related with mental health, and you didn't have people. So you only had maybe one group of people coming in,
Mhm.
and then you were creating assessments around that group of people. But you can't put that on everybody, right? So I think we're getting better at it as the stigma comes down, more and more people, and I guarantee assessments are going to get better.
Yeah.
Yeah.
That makes sense because I mean I know for sure in the African American culture that
Yeah.
That 70s, probably not until several years ago that counseling became a thing. Um, that was something you didn't do. It's like, oh, if you go to a counselor, you're crazy, something wrong with you. You know,
Yeah.
we you know, most African Americans have trauma in their lives. They just dealt with it, and they go on, they move on because that's what you do. And so it's when you said that really hit home, because I know that to be true for the African American community.
Yes. Yeah, yeah, exactly. Um, and I do think it's getting a lot better. Now, I had a teacher that, African American teacher that, that's kind of what he talked about a lot. He's like going, there is nobody, as he was growing up, there was nobody in his community that would go to counseling or anything like that. But the other part about it was it wasn't available in his area either. So now more and more is becoming available, which hence, but it's just we got to lower that stigma of it. And I think that's getting better. It's almost like, I hear people, well, my counselor says this, and I'm like, that's awesome. I'm so glad to even hear people say, my counselor says this, you know,
And
whereas
that's
when I was growing up, that was no.
right. That's the other piece too. In the African American community, many of them didn't have the resources financially to go to a therapist. So
Absolutely.
it's like, you know, if I already can't take care of what I've got to take care of, then you're talking about adding, going once a week to a therapist. That's not in my budget. So that
Mhm.
was another big reason why in our community that wasn't something that was, done. So
I'm so glad you talked about that too. It's like, in our counseling center, it's lower cost, so it's affordable for most or all, people. But here's the thing is like I look at what people are charging, for mental health. And here's the thing. You're probably gonna get, probably the same types of people all the time. It's not gonna be very diverse. And that's sad, for one aspect of it. And I think, in the code of ethics, it says, which I don't know. So in the code of ethics, it says a portion of what you do should be pro bono or at a lower rate. And, um, it's sad that they have to put that in there. Uh, and does everybody adhere to that? I don't know. I mean, they don't make people do that, but anyway, I
that,
get,
that reminds me of being in Dr. Smith's class
yeah.
for a case study that we had.
Well, tell me
I
about that.
I don't know if any of you guys remember this case study, but he had a case study, and I think it was ethics. And they were it was a particular therapist, and he was charging 300 something dollars an hour. We were like, oh, that's unethical. That's not everybody was going off like that's not right. He's milking them.
Yeah.
And lo and behold, he was like, that's not unethical. And I was like, we were like, what? you know, because we couldn't imagine charging somebody that amount of money. But he's like, yeah, depending on the demographics around you, you could do that. And I was like, but yeah, but what about the people that can't afford it? So, but yeah, we were like all outraged because that amount of money seemed ridiculous to
Mhm.
charge, but people do it.
It's funny because you bring that up. I'm part of this, group where this guy, I can't remember what the name of his thing. I don't know. It's called the Counseling Couch or whatever. He's a marketer for, people who are doing counseling, and he's like saying he lives in California, so take this with a grain of salt. But he's like going, well, I'm thinking about going back into private practice. I've done this marketing thing and it can run itself. And now I'm thinking about going in. He goes, I'm going into this area, and he goes, I'm thinking on charging $600 an hour or something like that. I'm like, where is this at? $600 an hour. And everybody on it was a Facebook page, and everybody's like going, what? I charge 100 or I charge whatever. And this guy's wanting $600. And I'm like, gosh, if you can get it, then, like here in Kansas City, see 3 people a week and you're good, or like that, you know what I mean? So, but anyway, I just thought that I'm like going, okay, but really, what are you doing with the people who can't afford that, and anyway, so I
I
think,
the church would be really good.
yeah, yeah, that's right. Yeah. Okay. See what I was going to go do one last thing with you. Oh, I know what it was. Hang on one second. Let me bring this up. Sorry about that. I got one thing I want to show you guys. Okay. Bring this up for y'all. Share with you. Okay. So we were talking about earlier, different forms of assessment and everything too. Just briefly wanted to kind of go over kind of what the Bible teaches us, about here, move this over. Hang on 1 second. I had one that's like what, about assessments. But this is kind of talking about, so the Bible teaches that all people are created equal in the image of God. And so this kind of goes back to um, how we view, and I think Charlie was talking about earlier, we were talking about being in the image of Christ and how we should view the people sitting across from us. And Genesis, 1, of course, God created us in his image. And so always kind of remembering um, the person sitting across from us was created in the image of God, and that's how we take care of them, right? And they're not, we're all part of that family. Proverbs says, 22:2, the rich and the poor have this in common. The Lord made them both. I love that aspect. The rich and the poor, right? And that kind of goes back to the guy charging $600, you know? No, well, what about, okay, you got the rich. What about the people who can't afford that $600? How are we going to help them? Anyway, so that's part of the ethics thing is being able to provide at a lower cost at times. So in Romans 3:23 says, all or are born under sin, all have sinned and all fall short of the glory of God. So meaning also through that we're all going to have, because of sin, we're going to have things in our life that we need to work on. And I think it was Charlie, we were talking, it's, because of that, we need to grow uh, in Christ And, some of these assessments can point out, just like regeneration, the assessments in that can point out in our life where we need God in different areas, more than what we've shared God in those areas. And so I think, regeneration is a great thing to be able to go through. John 3:16, every human being is the object of the love of God, so much that he gave his only begotten son for our lives, right? To die on the cross for us, right? So in Christ there is neither slave nor free, nor male or female. All need the love of Christ. My command is this: love each other as I have loved you. And when I'm working with couples and, we're, doing the couples assessments through and Prepare and Enrich and everything, I will bring this up. It's like my command is this: love each other as I loved you, but I bring up like Ephesians, 5, and talk about, maybe there's kind of a hierarchy of things. So, but we are to love our spouse like Christ loved the church. So what type of leader? So men, I'll go to men, I say, you're the leader of this household, right? Spiritual leader. What type of leader was Christ? So Christ was a servant leader, right? So if we're not serving, our spouse, we're not in conjunction with what we're supposed to be doing according to Ephesians 5. So that's where these assessments come in for marriage. The marriage assessments is, how are we doing along those lines? So assessing, because I've had men come in, they go, all right, Mr. Counselor, you tell them what Ephesians 5 says. And what I know what they're saying, wives, submit to your husbands. And that's all they read. Right? Wives, submit to your husbands. I'm like, no, you're not reading that whole thing. I get you, but no. And I love it when they do that. So we can come in and said, if you're not leading in the way of a servant leader, you're not leading correctly, right? So anyway, the Bible also teaches that God shows no partiality in his dealings with people, and that the gospel is proclaimed equally to all. So in Galatians 3:28 says, there is neither Jew nor Greek, there is neither slave nor free, there is no male and female, for you are all one in Christ Jesus. In Genesis 1:27, we kind of talked about that earlier. But so God created man in his own image. In the image of God, he created him, male and female, he created them. Acts 10. So Peter opened his mouth and said, truly I understand that God shows no partiality. So we're all equal in this aspect of, so that's where I was kind of going with that multicultural part is, yes, I think, these man-made assessments, fall short sometimes in the way that they were created. Are they getting better? Yes. Are they being revised? Yes, to include more and more. But I think we always need to go back to this aspect of it is, under the eyes of God, we're not different, and there should be no bias, discrimination, all of those things. What are your guys' thoughts on that? And I'll make this available here so you'll have all the scripture you need about equality and that. And I know I created a file for y'all that has different assessments for God. I apologize. I thought I had it up. And it's digging. This class I have the most files out there of all of them.
You were trying to find the file that has the assessments in it?
That are biblical.
Oh, I found a file that has just a bunch of assessments in it. Um, in alphabetical order. The serial
Oh.
killer assessment?
There you go.
Oh, that we needed that one.
Yeah. Okay. Let me see, because I know I uploaded this. I just don't know where I put it. I apologize. And I may have to just do this in the morning, and that's fine too. But really,
Can you share that serial killer assessment?
Yeah, that's
I had
something I might need to know.
You guys have it. It's in the file of assessments on class on Canvas. Go to file and
hmm
file that says assessments. Secretly, it's for Doug.
That's right. Oh, I know I put one out here. I just wanted you guys to see this. Oh well, I'll find it for you and we'll go in the morning. Okay, so are there any questions? Any thoughts? Okay. So before we end, what's your big ahas? What's your big takeaways for today?